Hello, everyone. I'm Donna Chacko, and once again, I'm here with Serenity and Health. And as always, I feel so privileged to be with you, but particularly so today with our guest, Dr. Kenny Lin. Hi, Kenny.
Hi, Donna.
So, those of you who have seen this show before know that my emphasis is on finding ways to link faith and health and interviewing really cool people who somehow in their life or their work or both um, demonstrate and value this interconnection. And a lot of health, I've always thought like this, is blatantly connected to our faith because we have the gift of health, we have our temples, and we're supposed to take care of them. And so I'm coming in that direction that I have Kenny with us today. And Kenny is a very good and old friend, and I know him through his wife, who is a very close friend, Dr. Marguerite Duane, and she and I used to work together. But Kenny is extraordinarily qualified to speak on this topic because of his education and his training and his experience. He is a faculty at Georgetown. He's the deputy editor of the American Family Physician. He had sterling medical education at Harvard, and he got a master's at Johns Hopkins in public health, right? But he's been
Yep.
interested always in how healthcare is utilized and how healthcare is wasted and used incorrectly also, and understanding risks and benefits and data. So he knows a lot of these facts that I don't really know. So it's fun to have evidence when you talk about these kinds of things like overuse. What's the basis for making these statements? So, with all that in mind, Kenny is going to talk to us today. We're going to just chat, and maybe you'll have comments or questions you want to send to us afterwards, because this is a really big topic about how to avoid healthcare boondoggles. So, big, broad topic, Kenny. Take it away.
So I'm thinking about this now because this is the time of year where we're doing lots of physical exams for kids going back to school or young adults going off to college or graduate school. So that's been, two-thirds of my visits over the last few weeks. And a lot of times people come in for a physical and they just say, I want all the tests. I want, I want the whole panel of stuff that you do at a physical. And some doctors have a standard panel. I think they probably just do on every patient, but I don't. And I have to explain that you have to have a reason to get a test. It can't just be like because you're there, because the normal range of tests is automatically set. So 5% of people getting the test will fall outside the normal range. And if you're having a symptom, say you have a headache, you're having chest pain, you're having constipation, and I get a test, and that falls outside the normal range, then that is likely to be correlated. So a test result that's abnormal probably has something to do with the thing that brought you there in the first place. Whereas if you feel completely fine, as most people do when they're coming in for a physical, that could just, you get an abnormal result just by chance. But after you get that abnormal result, we can't just say, okay, it's abnormal, fine. We have to do more testing to confirm that abnormal is a true abnormal, or maybe it's just something that happened by chance. And that can lead to what some researchers in this area call a cascade, where you end up doing test after test, following up abnormal tests.
Kenny, I saw your blog on that topic, and I know when I switched specialties from radiation oncology to family medicine, I really was overtaken by so many abnormal labs in healthy people. I didn't realize, and I think most people don't realize, how common, how normal, how ordinary it is to have abnormal results because of what you said. At least 5% of a normal test results really show up as abnormal, but they're really not. Boy, that creates a lot of stress for patients and complications for the doctor, doesn't it?
It definitely does. I think, yeah, it creates a lot of anxiety. Why are my results abnormal? And then the doctor feels pressure to and to investigate. But typically, the things that we use to investigate are either more sophisticated tests or sometimes even invasive tests that can cause harm to patients, either at least inconvenience or more cost, but sometimes the actual physical harm. If you're talking about perhaps a urinary, like a urine analysis that you do on a person and it maybe shows some microscopic blood. Well, there's a procedure that can be done to look for bladder cancer called cystoscopy, but anybody who's undergone one of those would say that's not a totally benign procedure. It can be uncomfortable and a very, occasionally it can actually cause more issues than it resolves.
Do you run into the circumstance where a normal lab test is falsely reassuring to a patient? Maybe they come and maybe there are issues, or maybe they have horrible health habits or whatever, but they come in and they get their labs and they're normal. So like, hey, everything's cool. I'm good. Does that happen to you?
I would say it doesn't happen that often to me because I try not to order things to reassure people, because that's just sort of asking for kind of Murphy's Law that you order something to reassure somebody and then it comes back abnormal.
Yeah.
There is kind of the reverse case of maybe you have someone who is overweight and they're not eating well, and you think, oh, if I order this cholesterol test, it's going to come back, really bad, and that's going to motivate them more. But the truth is that not all not everybody who's overweight necessarily has bad cholesterol, and so if you get a normal result back, you might have the opposite effect where the patient feels like, oh yeah, I can eat whatever I want because my cholesterol is great, and that's not the truth. But but that result paradoxically might reassure them in a way that's not good for their health.
Yeah. Is it hard to persuade patients that they don't need the lab results, that they don't need lab tests with their physicals?
I think I've gotten better at it over the years. I mean, there are some patients who really insist, and I'm not. I don't completely always hold the line. Like sometimes we can negotiate, say, okay, we'll get these tests because they seem a little bit more reasonable, and there might be a reason to do them. But I tell patients that in the past, like pretty much all doctors ordered a standard panel of tests. You could do it, before the visit because you didn't even have to see the patient because you're going to order the exact same tests. But in these days, like the philosophy is that you customize them to whatever your risk factors are, and that might include your age, your gender, your other conditions, how you're feeling, whatever might be circulating in your locality. So it's not, it's actually more personalized medicine in that we're picking fewer tests, but we're doing it because we know you better than just a person you would just run like the so-called executive physical, where I think people go in and they get not only blood tests, urine tests, but different kinds of scans. And I mean, that is seen as a luxury, but it's actually kind of a recipe for a boondoggle, resulting in much more, many more tests and possibly income for the places that provide it. So that's another thing that we can actually talk about, like the motivations behind, doctors' motivations maybe for doing testing.
I think that's a big topic. I have good values and I want what's good for patients, but I mean, there have been times in my career where I felt pressure to do stuff or order stuff that maybe wasn't necessary. And I hope I fought back internal, I hope I didn't succumb to those pressures, but I remember feeling them more than once. It's, you work for a system, your goal is to keep your job and keep that system going. And next thing, you're ordering tests and ordering procedures. Is there data on how common that is?
I don't know about specifically for, what you referred, as kind of feeling pressure to do it, but there's certain tests that have actually been studied. One of my least favorite is the prostate screening test, the PSA test, and they've actually studied that test, which it remains controversial whether that helps. I think, I will do it in selected men, but it's kind of a lot to get into. But basically, they looked at that to say if a hospital offered that for free, and just any man who walked up, didn't matter their age or their family history or anything, then the hospital was guaranteed a certain amount of income because they knew a certain number of those tests would be abnormal and they'd have to go see a urologist. And the urologist would perform a certain number of procedures or maybe even surgeries if they found prostate cancer. So the studies are actually pretty definitive that if you offer that test, you're going to make money for whatever system is providing the test. But it's still not clear how, who it helps or whether it even helps at all long term.
Yeah. Well, that points to the challenge that this problem is, because those men who got that PSA test, they probably felt good. They probably felt great. A free test. Either I was reassured it was normal, or maybe they picked it up in time. And, so there's this feeling of benefit. But what you're saying is that the downside is worse.
Right. There was an article that I think just came out in the Atlantic last week. It was about this, I think, kind of to me egregious example of overtesting, although maybe it's more common than we think. But the story centered around this young woman who'd had what turned out to be just an unusual migraine. But she was worried enough that she went to the ER. They thought maybe she was having a stroke, and they did some tests to find out. They didn't really conclude it, but they said you should follow up with a cardiologist just in case. So she went and saw a cardiologist. She got an echocardiogram, which is an ultrasound of the heart, and they found a patent foramen ovale, which is basically a hole between two chambers of the heart, which sounds really scary. You've got a hole in your heart, but turns out like up to a third of the population may actually have this and just not know it. And in rare cases, it can be the cause of a stroke. So the cardiologist said, well, we ought to fix this because it may have been the reason that you had to go to the ER and had these weird symptoms. She had the procedure done and then had all these long-term years and years of complications from the procedure. And then finally, after 10 or 15 years later, she found out that this cardiologist overdiagnosed this, and was performing all these procedures inappropriately in patients who were very unlikely to benefit. Just kind of closing the hole wherever it was there, except rather than the situations where it may have prevented a future stroke, and the procedure was unnecessary. And once she had it undone, she felt fine again.
Wow. Well, what do you say to patients trying to sort this out, or like where do they need to be most careful? How can they avoid unnecessary either testing or procedures? What do they do?
I think I would start by, whenever you're going to have tests done, asking, what's our next step if this test turns out abnormal? What are you looking for in this test? And if you find it, whatever it is, what will be the next step? I definitely do that for prostate cancer screening because I warn men that the next step could mean that we might have to have a urologist put a needle in your prostate to get a biopsy. And if you're not, if that doesn't sound like something that you would want to do, then maybe we should reconsider doing this test at all. So kind of finding out what the next steps are, and then they can also kind of ask, what's the likelihood I have whatever it is you're looking for? Is it even worth doing? Because some things are so rare that maybe 1 in 10,000 people will have it. And that's going to be far outweighed by the false positives, by the abnormals that come back that are really not abnormal. And then you're going to have to sift through all those to find something. There may be a reason to do them. We do newborn tests that often come back with false positives because the upside is so great that we can avoid these lifelong conditions by testing newborns. But in most adults, there's not a gigantic upside like that. We're looking for fairly rare things, and we have to keep in mind that there's going to be that in exchange for doing this test, you have to accept there's going to be a certain level of confusion and potentially anxiety while we sort out the result.
Right. We're talking mainly so far about unnecessary testing, and we kind of alluded to the whole other big topic, which is unnecessary treatment. Sometimes one leads to the other, for sure, right? An unnecessary test leads to a questionable diagnosis, and pretty soon you're getting your ultrasound and your biopsy. But I just have so often, when I think about, for example, people who have symptoms, take something really common like knee pain, or, they may be overweight and they may not exercise. They may not do the normal things that would help, but they want their MRI. They want the testing. And I think we all want answers. We want to know I don't know. It's kind of like a way to avoid having to face the personal lifestyle changes that might be necessary. Do you think that's valid?
I definitely think so. I think too much of medicine, unfortunately, is very mechanistic. Like we're looking for, your knee hurts, so there must be something structurally wrong with it that can be repaired, as if the body is just like a machine that if we just tweak something or we replace something, then it'll automatically fix it. And that is true in some cases. I mean, if you have really bad arthritis of your knee and you get knee surgery and you get a new knee, then that often can be very helpful. But in many of these cases where there may be something structurally wrong, like you have a meniscus tear, for example, which is super common in people our age and older, but fixing that often does not really do anything better than getting physical therapy, doing more exercise, losing weight. And obviously, if you're doing those things instead of the surgery, then you're saving a lot of potential side effects that can happen whenever somebody cuts into you.
But it's just so counterintuitive for human nature. I feel myself even reacting. Why wouldn't you want to have a procedure or get it taken care of? You want me to wait and see if all these changes make a difference all the while I'm suffering? It might take 6 months. Can I just have a procedure? It seems like the doctor patient relationship is just so critical here to work these things out, because it almost is like the fallback is let's get the test and let's get the procedure and let's fix it.
Yeah.
And that's a big task for to educate in the office with your patients. I bet you spend a lot of time at that, I bet.
Yeah, I mean, I think some of it is we're sort of spoiled by the media, particularly sports media, because you see that so and so athlete like injured their knee, they get an MRI like the next day, and they're in surgery like 2 days later, and
Yeah.
and I think you watch that and you say, well, that should be if I injure my knee, that ought to happen to me. But those athletes are actually just making a calculation that they need to get back on the field as fast as possible, and whether they have long-term consequences, they don't care about that right now, because you have a very limited window to earn your earning potential. Whereas if someone is in a different kind of situation, that might not be as important as making sure that this isn't going to bother you for life. I'm not going to have arthritic knees when I'm 30 because I had 3 knee surgeries in my 20s. So I think, as you said, knowing the patient and understanding what their values are is always really important. And if it's a patient that I don't know that well, then I try to elicit that and say, there may be 2 or 3 ways we can go with this. And these are the pros, these are the cons, and what's your sense of what which aligns best with what you would want. Right. Because people may make different decisions in the same situation, and both decisions could be correct. Right. So that's the other challenge. There isn't always like a one right or one wrong choice.
Right. So Kenny is a family practice physician, board certified. And many of you may know that I was a radiation oncologist for many years. And then I retrained in family medicine when I was 51. And then I became a board certified family medicine. And one of the reasons I made that change, just one of the reasons, was that when I practiced my specialty, I would observe how patients were being cared for. So I was, I didn't deal with the raft of their problems. I dealt with their cancer, but you get very involved. You see their doctors. And it was really obvious to me that those patients who had a good primary care doctor got better care. They got better care and they got less testing. I saw that over and over, because the patients who were not under a primary care doctor that was involved, because some aren't, they're just very peripheral, but those that had a primary care doctor that was involved in their care, they didn't run off to 10 specialists and get tests with each specialist. They just kind of stayed with their primary care, got proper referrals, got the care that was needed. And the results were better and the patients were much happier. So I'm a strong proponent of primary care, family medicine with well-trained people. And I wish our healthcare system supported primary care better than it does, because it's a really rough business right now to be a primary care doctor. Tough for patients too, with the system and kind of chaos. So anyway.
Yeah, there have been studies showing exactly what you said, that the patients who had continuity with the same primary care doctor over some period of years were less likely to get inappropriate tests. They were more satisfied with the care they received overall, because their doctor was helpful in helping them navigate, if they needed to see a specialist or they needed to get a procedure outside of the office, they'd have that advice and guidance.
I mean, I remember like a vivid case, an example with an old lady with an advanced cancer. And she had been with her doctor for probably 20 or 30 years. And they just quickly sorted out that she didn't want much done. And she had very limited diagnostic work. I think she had a needle biopsy, and then was referred for hospice care. It wasn't that she had widespread disease. She was just old, and she knew that she didn't want to have all that treatment. And for her, the results were not going to be very good anyway. So that would have never happened if she just walked in blindly to a doctor that didn't know her. I don't think it would have happened. I think she would have been, pushed through the whole routine. Anyways, another part of the problem. So is there science, is there data showing in what areas is the biggest waste or the biggest harm done in unnecessary testing or treatment, where we should be emphasizing our education efforts?
I think imaging is probably the largest chunk. I mean, it sort of suffuses the whole system. So there's waste in every area. But if you really wanted to spend time trying to reduce one area, I think it's imaging. And one thing that my health system has started doing recently is for certain types of tests, there's a decision support tool that will light up and kind of have you justify why you're ordering the test. I ran into it a couple days ago, and at first I was I was almost offended, thinking I'm a doctor, I know what I'm doing, I'm ordering this test, and then but then it sort of made me think through and checking the boxes for the appropriate thing. It didn't really slow me down. I think those kinds of things are as long as they're not posing a huge burden to the physician or their staff, I think are valuable. In fact, a little more valuable than having to deal with the insurance company denying it and then having to argue with somebody on the phone. I thought it was much lighter touch than, because sometimes the insurers use blunt instruments. They just, I swear that there are probably some insurers that say, deny all CT scans immediately, make the doctor call us, rather than saying this is appropriate, this is not appropriate. We just want to make sure you're not, skipping a step in the ordering of that. You might be able to get an X-ray first or do something else. Right. So ultimately, I think that's a good idea if that can be done with cooperation with physicians, not sort of, so we can kind of work with the people who set up the electronic medical record alerts and not sort of have them appear without our knowledge. Right.
Yeah, imaging, I can see because the cost is so great. And also the incidental findings, the tiny little cysts and the little questionable scar that might be
incidental lomas. Right.
What is it again? What did you
we call them incidental lomas. They're the things that are probably not cancer. They're 99%, not cancer, but they're, maybe 1%. And then you have to, keep an eye on them, and the patient has to undergo additional testing just to make sure that it is truly nothing.
Right. I thought about imaging and testing a lot when I was going through my own issues with pain, because I recognize this was like hip, low back, all kind of asymmetry, weakness. I ended up with a hip replacement. But in the process of all of this, I just had a lot of pain issues, and I didn't understand them, why I was having pain in all these various places, even after surgery. And I kept asking the doctors, and I don't think it was abundantly clear to anybody. And I think this phenomenon is extraordinarily common. Even back pain, we say somebody has lumbalgia or back pain. A lot of times we don't precisely know if it's a nerve, a muscle spasm, arthritis, exactly what it is. But I felt myself sometimes wanting to have every single test to figure it out. I wanted to figure it out, right? But eventually I realized I didn't, I might need those testing, right? I had a doctor. I wasn't going to abandon my healthcare provider, but I just finally realized, hey, I just need to really work and get some help and start a better physical therapy exercise program, not to necessarily replace all testing, but maybe even simultaneously. You just cannot, what my message is, we just cannot always wait until we have the perfect answer, because there may be no perfect answer. And if you're waiting to start self-care until there's a perfect answer, you may have a very long wait. And I don't know. That was my personal experience. I have the feeling it applies to other people.
Yeah. I had a patient with chronic hip pain, and it really bothered him because he loved playing tennis. And he went to specialist after specialist to try to figure it out. He actually underwent several courses of physical therapy. Nothing helped. And then one day he saw something on YouTube about just it was just kind of a general thing about self-care and gentle stretching and meditation. And he did it for a few weeks, and he said, then the pain went away. Like, I'm not absolutely sure that one led to another, but it kind of showed how mysterious sometimes this can be, that you can try to find all the mechanistic explanations, and then one day your pain just gets better. And but I think a lot of it did have to do, I think, with him mentally being in a better place.
Yes. Oh, I mean, that's right. My message, Kenny, you hit the nail on the head. If you're angry and frustrated, you're going to have more pain problems. When John Kabat-Zinn started off with his mindfulness and meditation, mindfulness-based stress reduction program 20, 30 years ago now, it was so weird at the time and strange, but they got referrals of patients where everything else had failed. They chronic pain, chronic problems, just really miserable patients. And they started following this multifaceted program that involved the things you mentioned, meditation and reflection and breathing and all sorts of things like that, along with conventional stretching. And anyway, people surprisingly got better. And that's kind of my experience. Sometimes to address your hip problem, you have to address your overly busy brain or whatever. Maybe that was my problem. Maybe that was my problem all along. Oh my gosh. This is such a huge topic. I wish I knew what to say to like, are there 3 things that people can do? You mentioned the questions they should ask to, when the insurance is paying for everything, folks don't have the financial incentive. It's not their money they're wasting. But regardless of that, they should ask questions. So can you just go over again what you said, that kind of questions they should ask before testing or procedures?
Yeah. So, what are you looking for with this test? Kind of what's the purpose of the test? If the test does find what you're looking for, or some other abnormal value, what's the next step? And probably the third, is it necessary for me to get this at all? Like, that even if you're looking for something, is it really likely that you'd find this? And is this something we could pass on? I have patients ask me that. I tend to attract kind of patients who are less interested in a whole bunch of tests, because I think they understand that's my philosophy. But I've had tests that I've recommended, and the patient said, what's the chance that they find something like this? And I'll tell them the statistic and say, that's not good enough. Like, it's not worth it for me.
Right.
So I think those are the 3 key questions that I would think about.
Yes. And we didn't even address it, but those same questions could be asked when you're taking medications, because a lot of unnecessary medications.
Yeah, absolutely.
Way many unnecessary medications are given, where self-care and more questions asked and more understanding of risk would make a reasonable person not want to take those pills. That's kind of a scary one. Yeah.
Yep.
So we all have to not want immediate gratification. We all need to take care of our beautiful gifts of our health. And we need to have a doctor we hopefully like and trust, and then ask a lot of questions. And also, if as patients, we can help our doctors so much by being a bit organized. The healthcare system only gives the doctor a few minutes. And if you come in there and they ask you where you heard, and you go, oh, I heard all over, and last week it was here, and then it was here. And, you could talk for 10 minutes of the 15, and the doctor wouldn't have the vaguest idea what your problem was. So before you go to the doctor, sort out what are your main issues and how long, and just do your best to succinctly describe what's on your mind, what you want out of that visit. You would get a whole lot more out of it, and your doctor would be able to serve you a whole lot better. All these experiences in the family practice clinic are coming back. The common, not uncommon answer to the question was, where do you hurt? Is, oh, todo el cuerpo. My whole body hurts. Like, oh gosh, where do we start?
I like to ask patients sometimes if they come seeking tests that seem exotic or unusual, what are you concerned about? Why do you want this particular test? Because sometimes I can redirect and say, okay, well, that's not the test we'd look for, rather like these are the things that you would be feeling if you had this condition. This is what you should let me know about. If you're not having any of these signs, then you're most likely don't have that thing you're scared about, because things happen to people's friends and family. And then you start wondering, well, if that could happen to them, could it happen to me? Exactly. But we don't want that to lead us down kind of the rabbit's hole of unnecessary testing that's not going to really produce anything that's going to be helpful for someone's health.
Yeah. This is all extraordinarily valuable advice, especially in these stressful times where everybody has stuff going on in their lives, and there's certainly too much stuff going on in our country and the world. You should all know that Kenny has a terrific blog. It's called Common Sense Doctor. And in the show notes, I'll list the blog. You can subscribe. I strongly recommend. And he will list some examples of previous things he's written that are relevant to these topics. I think it's extremely, extremely important. Just whatever you do, don't put testing and all the doctor stuff ahead to replace what you can do for your own health. We have to participate in our care and take care of our bodies. And I think what Kenny has written is really, really good advice in that regard. And I think you're going to have some other things that, anyway, he's going to give me some references that I can put on the show notes. And if you would like to reach out with questions to him or me, we'd be honored and grateful. And I don't think I have anything else. I feel like I'm forgetting something, but I don't
Sounds
know
good.
what that might be. Kenny, thanks very, very much for agreeing to do this. I knew I would enjoy this conversation, and I did, and I hope that it offers value to those who listen to it. So I appreciate it very, very much.
Thanks for having me on.
Okay, take care. Bye-bye.